From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, those parts of Southern Kentucky, and West Tennessee. Welcome to Pharmacist on Call. Your host, Dr. Shawn Pruitt, the owner of the Kangen Water Store, the owner of Pruitt's Discount Pharmacy located at 811C Dickerson Pike. If you are watching this show, I am your community pharmacist. Well, everyone, welcome to the July edition of Pharmacist on Call, a show that is your 1-hour forum to call in with those health questions that you have, or even comments if you have them. We understand that your doctors are busy and that your pharmacists are busy. They don't have time for this 1 hour. I do. So call in with those questions, those concerns. A few housekeeping rules. The first rule is feel free to call in and ask anything. Second piece is there are no stupid questions. Chances are that those burning questions that you feel are silly and mundane that you want to ask, someone else is probably thinking about, and you know what? That question may even help them. So feel free to call in. They'll have the number up, 737-7587. That's 737+. Just wanted to send out a quick condolence to some friends of the pharmacy, the Van Treese family, the Neely family, the Duke family, and the House family. Wanted to send condolences out to them for the loss of their loved ones and to let them know that Pruitt's Discount Pharmacy is thinking about them and you're in our thoughts and prayers. I also wanted to thank those of you at Schrader Acres. I'll be speaking with them in a couple of weeks. So wanted to give a shout out to our friends out there, as well as our friends at Casey Homes and our friends at River Chase Apartments right by the store. I wanted to, for those of you who are first-time viewers, I kind of want to give you a background about the show. The show sprang out of the Open Line series that was hosted by Kristen Priesall and Rory Johnson to some extent, and it was the Ask the Pharmacist segment where I would come in and they would ask me questions about, pretty much about anything medication related. Because of your support for that show, News Channel 5 Plus offered me the opportunity to come and to do this show where I, by myself, take your questions, your calls, and your comments with the limited knowledge that I have, see if we can, come to some resolution of your healthcare issues. So I started that on my own maybe about April of last year. So we've been doing this the better part of 14, 15 months now. You all have supported it very well, and so we thank you for your support, especially for those of you who come great distances to the store to purchase and to meet us. Those from you all the way from McMinnville, parts of Southern Kentucky, Columbia, Pulaski, Lewisburg, coming from all over to support the pharmacy. Yep, I'm sorry. Got a couple from Jackson, Tennessee as well that have come to stop by after viewing the show. Also wanted to let you know just a little bit about me, just to give you kind of a history of who I am. And the reason I do this is because it always seems that I have new viewers each show. So I grew up here in East Nashville, attended Maplewood Comprehensive High School, where I graduated from in 1988. From there, I went to Austin Peay State University. I did that for about 4 years and transferred to Tennessee State University, where I received my bachelor's degree in chemistry. From there, I went on to the University of Tennessee College of Pharmacy, go Vols, and graduated from there in 2000. After that, I did a long stint with Walgreens, and kind of in between there, I was the pharmacy director for Access Med Plus. For those of you who are old enough to remember the first 10 care plans, it was the largest plan in the state at that time. So I served as their pharmacy director until we lost our contract with 10 Care somewhere around 2001. So I went back to Walgreens, and many of you viewing the show may recognize me as a night pharmacist from Bordeaux over at Clarksville Highway. I did a long stint there, and I had a great time. So from there, we kind of had a parting of ways, so to speak, Walgreens and I. And so this begins the history of how the store came to be. So I was sitting there trying to figure out what the next phase of my life would be like. So I started doing research on maybe opening my own pharmacy and seeing how well I could take care of people to the extent that I wanted to take care of them. So I started researching pharmacies and different themes and different independents, and I came across some research done by the Tennessee Safety Net Consortium. And the Tennessee Safety Net Consortium, in conjunction with Tennessee State University, did this research to study the impact of being uninsured on Middle Tennesseans. And what they found is that during that time, I believe it was maybe in the late 90s or so, that there were 85,000 plus uninsured Middle Tennesseans. These were people who, by and large, you either paid the cost of the medication or you did without. Now, the problem with that is that if you go to the emergency room because your blood pressure has spiked or because your diabetes has spiked, you go to the emergency room and they give you medications and send you to the pharmacy gives you an outrageous price. Well, you may not be able to afford these, and so you have a decision to make, whether to scrape the money up or eat, keep your utilities on. And so some people will leave those prescriptions there, go home and get worse, go back to the emergency room, only to be given another set of prescriptions that they still can't afford. And so they go back home after the discharge again, after leaving those prescriptions there, and then sometimes they don't wake up to see the next day. And so this, not only does it cause issues with morbidity and mortality, it also causes increases in healthcare system waste, because you're repeatedly going back to the emergency room when, if medication were affordable in the beginning, then we wouldn't have to have this continuous vicious cycle of you going to the emergency room and basically cluttering up the healthcare system. So I said that would be the theme of the pharmacy that I would open. So I named it Pruitt's Discount Pharmacy. We opened August 4th, 2012, with a mission to help those, I'm sure now 100,000 plus uninsured Middle Tennesseans. We've been doing that for, well, August 4th, it'll be 3 years that we've been doing it, taking care of people in terms of making their medication affordable. But not only that, our other focus, other than making medication affordable, is customer service and making sure that people are treated well and with respect. I'm sure many of you out there have horror stories about how you've been treated at pharmacies, or whether it's because they didn't necessarily care for your doctor, or something about the pain medication or the medication for anxiety may have triggered a suspicion, or sometimes people just make judgments about you based on how you look. So what we wanted to do is take those people and show them that we can still do our due diligence in terms of dispensing medication responsibly, but also do it in a respectful manner. We have done that by and large, and so by and large, most of our patients are very happy with the service that they receive. We get a lot of referrals by word of mouth. And then the other focus is patient education. We believe that educating you will also help decrease the burden on the healthcare system, because now you understand what symptoms to look for when you're having side effect issues with your medication. Now you understand how to correctly take your medication, and also to alert your pharmacist if there are other problems. And there's certain lifestyle changes that whether it's dietary or eliminating smoking or alcohol or anything like that, we believe in educating people about how to better take care of themselves, and also preventative, how to just stop things from happening to begin with. Hence, we have this show. It is a health education show. And as you'll notice, for those of you who have watched a long time, we talk a lot about natural products, about natural medicines. And so that's a big thing with us as well. We believe that natural medicine and conventional medicine can coexist. So the herbs have been here for thousands of years. They have taken care of people for millennia. So we believe that used responsibly, that they can help you on your road to health as well. I also wanted to, as we're going on to the history of the store, 3 months after that, we did what was called the Kangen Water Store of Nashville. And what Kangen water is water that goes through about 4 different processes. And the first process that it goes through is the water is alkalinized, and so it's raised from an acidic level of 6 or 7 to a pH of 8.5, 9, and 9.5. And so 3 other processes that they go through we're going to get back to, but right now we're up on a break. So you stay right there, call in with those questions.